First News with Keeler in the morning on WIBX and WIBX950.com.
Without the ones like you, who work tirelessly to keep things running, everything would suddenly stop. Hospitals, factories, schools, and power plants, they all depend on you. No matter the weather, emergency, or time of day, you're the ones who get it done. At Grainger, we're here for you with professional-grade industrial supplies. Count on real-time product availability and fast delivery. Call, clickgrainger.com, or just stop by. Grainger, for the ones who get it done.
We just learned that the mayor called up Dr. Kent Hall and said, hey, you want to buy a parking garage? And he said, I don't think I need one. And that's how the hospital was informed. I believe that's how it went down. That's what we're hearing. None of that is true. Good morning, Dr. Kent Hall. Good morning.
Good morning. How you doing this morning?
My apologies attempting to drag you into this whole thing. But, you know. Okay, let's start with your numbers. We over the weekend learned that New York is on the rise, and it's happening in the summertime, which is very interesting because last year, July and August, we were on the decline.
Yeah, and I think that goes to, the fact that last year in July and August, we were, very much had in our heads about social distancing and wearing masks and things, and obviously those are things that we're minimizing now to a very great extent. So as of right now, we have 4 patients in the health system that are admitted for COVID-related problems. I will tell you that 2 of them have been fully vaccinated and 2 of them have not been vaccinated. The 2 that have been fully vaccinated are relatively elderly with comorbidities and are actually doing pretty well. They're in our lower acuity units. The 2 that have not been vaccinated are both younger and are both in the higher acuity units. So I think that is an example of, getting vaccinated helps. It's not a panacea. Remember that the vaccine does have a, I guess for lack of a better term, a failure rate of about 4 or 5% or more, depending upon which vaccine you're talking about. But for the individual, that failure is 100% because it's for them. So we have to understand the difference between talking about a population and talking about what the individual experiences.
So, I think it is important that reaching a certain percentage of people who have been vaccinated, the importance of that, and maybe you can discuss this just a little bit, and I'll kind of throw it at you in layman's terms. Basically, if everybody's been vaccinated, you've reduced the virus to the point where that 5% failure rate that you talked about isn't as vulnerable because the virus is being squelched to the point where it's almost becoming non-existent if everybody's vaccinated.
Right, and that's exactly what herd immunity does. What it does is to say that there basically aren't enough targets for the virus to continue to propagate through the population, and so it basically stops propagating. The virus doesn't necessarily go away. Smallpox still exists. It just doesn't cause disease because there are so many people that are vaccinated and that have been protected that now it doesn't circulate anymore. So that's actually a bad example because actually smallpox, with the exception of being in some labs, really doesn't exist anymore. But it's because of that. So what we're looking for with COVID is that if we can get 70, 75, 80% of the people immune where they will not propagate it, then the other 20 to 30% of the population will be protected and will not get sick simply because they won't be exposed to it.
A couple of questions. I don't know if you know this, Doc, but I'm just curious. 2 things. Do we know, is the COVID lottery still going on in New York State? And is there any evidence that you're aware of that shows these incentives that were offered did nudge a certain percentage of people to get the shot? And do you think they should continue to offer them?
So I don't know whether the COVID lottery in New York State is still being used or not. I do know that incentives do work, but they only work a little bit. I mean, really, there is you have to use every tool that's in your toolbox. So
Sure.
incentives are one. They're probably not the most powerful. I think the most powerful is actually one-on-one conversations where people who have not or who have been vaccinated, have a conversation with someone who is hesitant about it, to understand why, to explain why it is that the vaccinated person got the vaccine. I think that is probably the most powerful tool that we can use to actually start to move people who are a little more hesitant or concerned about it.
I want to go to Tom in Utica with a question. Hi, Tom. You're on with Dr. Kent Hall.
Yes. Why doesn't the CDC emphasize that the worst comorbidity, other than being old, is obesity? When you see a young person have a bad outcome, 98% of the time, they're huge. They don't even. Are they a fat shaming people?
Be careful. You be fat shaming yourself here. Be careful, Tom. Doc, what do you say to that? Is that true?
So actually, Tom is right. Obesity is definitely one of the significant comorbidities, along with diabetes and heart disease and lung disease and things like that. And for people who are young, it does seem to be that the people who are most obese, so with BMIs above 30 to 35%, usually about 35%, seem to be at risk for the most severe disease. I wouldn't characterize it necessarily as fat shaming or anything. I would say that this is just the reality of it, And,
but they don't say anything to people.
Well, I think physicians do.
But the Fauci came on and said, "People, lose some weight and it'll help things."
I see what you're saying.
Well,
Tom, I'm gonna hang up and let Dr. Hall finish on your comments. Okay. Thank you, Tom. Oh, Tom hung up before I could hang up on him. Are we not doing enough, Doc? That's what Tom is saying.
Well, I agree with Tom in terms of we need to keep refining what the message is. We need to do it in ways that aren't shaming to people. So we certainly don't want to say, "Hey, you're overweight," and I'm not going to use pejoratives, but you should be getting the vaccine because of who you are, or because of the way you look or something like that. You should get the vaccine because it will benefit your health and it will benefit your community's health. So, and yes, I very strongly go with what Tom says in terms of when I'm talking to an individual, I will say to them, you have risk factors that make you more susceptible to having severe disease. And one of them is the fact that you're overweight. Yeah. I mean, that's just a reality.
And what do you say to those people about, how they should be careful? Early on in the virus, there are some people that believed, well, listen, I'm not vulnerable, so I shouldn't have to be subjected to all of these restrictions. People who are vulnerable should stay indoors. They're the ones that should shut down. They're the ones that should wear the mask, not everybody else. I'm not sure you agree with that, but what do you say to those people who are vulnerable?
So that goes to what I said at the beginning, which is that the population is will say that if assuming that nobody was vaccinated and everybody was healthy, then your chance of getting severe disease is 1 to 2%. Okay, well that sounds pretty good. That sounds like, well, then I really shouldn't be that worried about it, unless you're that 1 to 2%.
Correct.
And
right.
You never know when you're going to be that 1 to 2%, and so that's where I say, you're playing the odds, but if you lose, there's no going back, and you have to acknowledge that as well.
Just a quick thought, and I think everybody understands where Tom is coming from, and Dr. Hall mentioned that as well, that he understands where he's coming from. But I just want to say, Fauci is like the top infectious disease expert in the country, if not the world. We won't listen to him on getting a shot. So when it comes to probably cut down on the fast food and try to take a walk twice a week, they're not going to listen to him on that either.
Yeah. I'll tell you this. I had said that 2 weeks ago on vacation I traveled, and I just couldn't believe the number of young people, Doc, that are driving around on Rascals at Disney. riding up, and I get it gets you past the line, but the reality is they're big and they're in a very dangerous place. But a lot of young people, I was kind of surprised by that.
Yeah, I would say, looking at all the comorbidities, whether it's morbidly obese, whether it's high blood pressure or heart disease or lung disease, if you're not vaccinated and you have any of those, you should be wearing a mask. I mean, there is absolutely zero question in my mind that is the reality. And you may or may not take my advice, and that's certainly up to you. But I can tell you that if I was, if as Tom said, if I were Dr. Fauci and somebody came up to me and said that's what I would tell them.
Yeah, if you don't have the strength to be able to walk from point A to point B, chances are you're going to struggle in fighting off this virus or any other virus that you come in contact with, I would think.
Yeah. And this virus is particularly bad.
Yeah.
Dr. Hall, we have somebody asking, are the 4 people hospitalized currently infected with the Delta variant?
So we don't know that. The Department of Health, through their Wadsworth lab in Albany, gives us direction in terms of who we should be sending swabs to them to be tested for, or to have the genomic testing. Right. And so we do that on an intermittent basis based on their recommendations and their requests. I can't speak to whether any of them have tested positive for the Delta variant.
All right.
Sue says, my son is a pharmacist in Las Vegas, and he had a large increase with people coming in for the vaccine. I asked him why. He doesn't know, but he thinks it's people getting rejected trying to get into places and people wanting to travel. My son also told me a long time ago if everyone was a healthier weight, we would be able to get rid of half of the drugs we prescribe today.
Probably. Yeah. Interesting. All right, Doc, we appreciate it. Thank you so much. Have a wonderful day.
Thank you, everybody. Please be safe and stay cool. It's going to be a little warm and muggy today.
Another hot one on the way. I'll take it. Okay, thank you. Have a great day.
For the ones who work hard to ensure their crew can always go the extra mile, and the ones who get in early so everyone can go home on time, there's Grainger, offering professional-grade supplies backed by product experts so you can quickly and easily find what you need. Plus, you can count on access to a committed team ready to go the extra mile for you. Call, click Grainger.com, or just stop by. Grainger, for the ones who get it done.